Florence Nightingale once said, "Nursing is a progressive art, such that to stand still is to go backwards." At the University of Rochester Medical Center, the COVID-19 pandemic demanded nurses move forward in a way unlike any other in recent history. To meet the rising demand of COVID-19 patients, elective perioperative procedures were stopped for 3 weeks starting in March of 2020. The occupancy of Golisano Children's Hospital went down by more than 50%, and an ask was made. Could nurses from all units of Golisano Children's Hospital, trained in pediatrics, help take care of adult patients at Strong Memorial Hospital? The answer was yes, and many of our nurses were soon working side by side with entirely new colleagues on unfamiliar units and with a very different patient population than what they were used to.
If you had told me 2 years ago that pediatric nurses would be taking care of adults or that we'd have adult patients in the pediatric hospital, I would have told you were crazy.
Nurses knew the stakes were high. Some of these adult patients with COVID-19 were very sick with a very contagious disease. Summer of 2020 brought a short break as COVID cases decreased in the Finger Lakes region, which allowed time to recalibrate. Through feedback and focus groups, pediatric nurses suggested a different approach.
They told us, hey, we were happy to help, but if we have to do this again, we would love to have our team stay intact, stay in our home units. We know where everything is, we're comfortable there, and you bring us the patients that you need us to take care of. And I thought, wow, that's kind of brilliant.
So that became the plan and the new ask of pediatric nurses in December of 2020 as the second COVID-19 wave began. Adults were moved to parts of the 6th, 7th, and 8th floors of Golisano Children's Hospital. An OB unit was even converted to an adult long-term care unit.
Certainly, we knew it was a really big ask, but I remember the relief that I felt because I knew that the patients would be well cared for in the Children's Hospital, and I also knew that we wouldn't have to have 2 ICU patients in the same room, which was going to be an incredible thing that we were hoping to avoid in the adult hospital. And because of the Children's Hospital and the perioperative areas, we were able to avoid that.
I can't imagine what the staff on the 7th and 8th floors thought when they first heard the message that you'll be taking care of adult COVID patients.
Dr. Justin Hopkin moved with the patients from the adult side of the hospital to the pediatric side and worked there with pediatric teams for months.
We saw some astounding results of patients that were very critically ill who were transferred over, expected to be discharged to rehab facilities because of their weakness and deconditioning, who under the care of the team and the staff on the 7th and 8th floors improved and were able to go to different facilities, often home, rather than a rehab facility, which is a win for the patient and a win for everyone.
On the 6th floor, a slightly different model. The adult ICU teams handed adult patients and their care management over to the pediatric ICU teams.
We were at the ready to help with consultation questions and come over and assist when needed, if needed, but honestly, they did the vast majority of the work with those patients. This was an incredible example of just the adaptability and courage of a team of nurses who really this was not what they signed up for. And they did it with their heads up and smiles on their faces and with cheerfulness, and we're indebted to them.
Adult patient Cheyenne was cared for in the Children's Hospital.
The care I received from the nurses was beyond amazing. I remember this one time after my surgery, I was having a very rough time, and one of the nurses sat in my room with me for what felt like hours until I felt calm and more comfortable. I can't tell you what that meant to me. It meant so much.
The pandemic tested nurses caring for kids and babies as well. They cheered on and checked on their colleagues who floated to care for adults, while also continuing to provide top-notch pediatric care.
We just want to send a huge thank you to the NICU nurses at Golisano and Strong Unit 334 for taking care of our babies during the pandemic. Not only did they keep them safe and thriving, but they also were a huge support system to my husband and I. We will forever be grateful.
Born during a pandemic, a storyline these families will be able to tell for years to come. Nursing during a pandemic, A call bravely answered in many ways by our Golisano Children's Hospital nursing teams.
We asked really hard things of them. I asked really hard things of them, and they responded in kind. And it wasn't easy. It was very difficult. It was stressful. It was something that we never thought that we would need to ask. And I want people to know that every contribution, whether it was giving vaccines in a vaccine clinic, whether it was being part of the hygiene team, whether it was floating to another unit, whether it was taking adult patients onto your unit, whether it was the ICU or the long-term care patients that were on the general care floors, your contributions made a difference for patients, for families, and for Strong Memorial Hospital. I am incredibly grateful.
To our nurses, we thank you, we honor you, and we move forward together, once again focused on our pediatric mission of helping every child reach their fullest potential.